Good day everyone. My name is Mark Lawrence D. Calma and this is my co-researchers. Patrick Roy T. Chabian, Noe Y. De La Cruz, Crispin M. Lopez, Jude Ivan A. Mendoza, June M. Mortel, and this is our topic. Responses of jail officers on the COVID-19 positive person deprived of liberty at Bataan Jail.
Chapter 1. The problem and its background. Research problem. Macro problem. Some of countries on Southeast Asia, like Myanmar and Indonesia, have already temporarily released prisoners to protect against the spread of the virus, while Iran freed about 85,000 prisoners temporarily. Most of them are non-violent offenders, serving short prison sentences. Micro problem. More than 300 COVID-19 cases have been confirmed among those behind bars. Most in the detention facilities in Cebu, Southern Philippines, at least 4 detainees have already died from the virus, while dozens of people working in prison have also tested positive for the virus. About 10,000 inmates would be released in an attempt to stop the spread of COVID-19 in the country's detention facilities. The detention were released following a directive issued by the Supreme Court to release those who were being held ahead of trial because they could not afford bail, as well as certain elderly and ailing prisoners and those whose sentence was 6 months or below. Research law of 7 states at the Bataan Provincial Jail were found infected with coronavirus disease 2019 COVID-19. Based on the latest report of the Provincial Health Office, aside from the 77 PDLs, the other new confirmed cases are 5 from Pilar, 4 from Balanga City, 3 from Dilalupian, 2 each from Orion, Mariveles, and Nabukay, and 1 each from Orani, Bagak, Limay, and Samal. Statement of the problem. What are the responses of jail officers to the COVID-19 positive persons deprived of liberty in Bataan District Jail? Statement of the problem number 1. How may the respondents be described in terms of 1.1 names, 1.2 rank? Number 2 question. What are the responses implemented by the Bureau of Jail Management and Penology with regards to dealing with the COVID-19 persons deprived of liberty? 2.1 Medical isolation and quarantine. 2.2 Testing considerations. 2.3 Medication for prevention of severe COVID-19 cases. 2.4 Vaccination for PDA, and 2.5 Infection and prevention COVID control. Number 3 question. What are the strategies for applying and sustaining COVID-19 prevention measured inside correctional and detention facilities with regards to the following matters? 3.1 Visitations. 3.2 Preparations for outbreaks. 3.3 Strategies for everyday operation. And 3.4 Enhanced COVID-19 prevention strategies. Significance of the study. Bureau of Jail Management and Penology. For further evaluation and assessment to develop much more better plans and securities. Ang BJMP po ay nagkakaroon ng assessment and develop plans and securities. Bataan Provincial Jail. This study will be a guiding principle to all jail officers and will serve as a reminder on their responsibilities. Ang Bataan Provincial Jail po ay nire-remind ang lahat ng jail officers sa kanilang responsibilities. Jail officers. Reminder for the duties and responsibilities of them that aside from enforcing rules, regulation, and keeping peace and order inside the prison or jail. Ang jail officer po, hindi lang sila nakapokus sa responsibilities nila sa mga inmates, kundi nakapokus din sila sa kanilang rules and regulations. Significance of the study. Health agencies or the tabulated information by the researchers may be used to open opportunities for further support of health agency in our country. With this matter, with that spread of virus will be lessened to the whole community. Ang health agency po ay nagbibigay ng swab testing and vaccination para sa inmates. Non-governmental organization. The evaluated data in this study will touch the helping hearts of non-profit organization to aid the needs of inmates during pandemic through various donation drives. Ang non-governmental organization po ay nagbibigay ng supporting needs and donation program. Future researchers, this research will serve as their future reference as researchers by serving as a foundation of the project for future knowledge enhancement and more through examination of the problem and its purpose. Scope and delimitation. Research local. Bataan District Jail, Orani, Bataan. Number of respondents, 5 jail officers. Up to do. Any request and demands of this body will be complied with by the researcher to be able to have legitimate data. Most importantly, the researcher will give copies of the documented files of the present study to the Bureau of Jail Management and Penology and Bataan District Jail as a form of respect and gratitude. Theoretical framework. This is our IPO. Respondents profile in terms of name, rank, responses implemented by the BJMP regarding the COVID-19 persons deprived of liberty in terms of medication, isolation, and quarantine, testing considerations, medication for prevention of severe COVID-19 cases, vaccination for PDL and infection and prevention control, strategies for applying and sustaining COVID-19 prevention measured inside the correctional and detention facilities with regard to the following matters: visitation, preparation for outbreaks, strategies for everyday operation, and enhanced COVID-19 prevention strategies. Process: interview, documentation, focus group, discussion, field observation. Output: documented responses of jail officers on the COVID-19 positive persons deprived of liberty at Bataan District Jail in Orani, Bataan. Conceptual framework. Figure 1 shows the paradigm of the study. The conceptual framework of the study shows the concept in helping out the knowledge regarding the responses of jail officer on the COVID-19 positive persons deprived of liberty at the Bataan District Jail in Orani, Bataan. The first frame shows the input, which include the querying of information about all the responses from the key informants and the implication of the study in the program of researchers. The second frame presents the process of the study to be used. This include the interviews, documentation, and focus group discussion. The third frame presents the output of the study, which is the documented responses of the Bureau of Jail Management and Penology among jail officers during pandemic. The solid line of posit the relationship of the input, process, and output in the study. Chapter 2, Theoretical Framework. Relevant theories. Number 1, behavioral change theories in help with itself belief model were developed by the U.S. Public Health Service in the 1950s to understand the failure of people to adopt disease prevention strategies or screening tests for the early detection of disease. It also focuses on the patient responses of symptoms and compliance with medication treatments. Number 2, crisis intervention theory. This theory focuses on dealing with significant health events as crisis event. It also predicts that the closer the intervention is to the crisis, the greater the success of the intervention. Number 3, theory of planning behavior. Interestingly, numerous studies have addressed this association during the COVID-19 context. On several health behaviors such as physical distancing, mask wearing, and hand washing, intervention of traveling, and intention to receive a COVID-19 vaccine. Related literature. Medical isolation. The practice of isolating incarcerated people from the rest of the prison population when they show sign or test positive for COVID-19 to stem the risk of COVID-19 transmission throughout the prison. Warranted. The practice of separating and restricting the movement of people who may have been exposed to a contagious disease until the result of a laboratory test confirm whether they have contracted the disease. Testing considerations. Because of the risk of unrecognized infection, a single new case of SARS-CoV-2 infection, a staff member of resident is a correctional or detention facilities should be evaluated as a potential outbreak. Types of testing should be prioritized like viral, NAT, antibody, antigen, or serology tests because this can differ based on related literature. Medication for prevention of severe COVID-19 cases. Antiviral medications are now available that are effective in preventing severe outcomes from COVID-19 with variety of products in variety of costs. But the above mentioned statement of IEFTF only means the medication are not a substitute for vaccination. Corrections management should consult facilities healthcare provides about their use for post-exposure prophylaxis. For communication into public health partners and correctional partners. As correctional partners in which is communicates with other correctional facilities to share information including the number of cases and deaths, disease surveillance, and absenteeism patterns among the staff, and where possible put plans in place to restrict transfers of residents between facilities during their quarantine or isolation period. Unless release from custody or a transfer is necessary for medical care, infection control, lack of quarantine, isolation space, or extenuating correctional, judicial, or security concern can be stopped. Consideration for re-entry programming. If a person preparing for release is not up to date on their COVID-19 vaccine, offer vaccination again if they decline, provide them with information about where they can get vaccinated after release, provide screening testing before release for all residents regardless of COVID-19 vaccination and booster status. For infection and prevention control, Infection Prevention and Control, or IPC, is a practical, evidence-based approach which prevents patients and health workers from being harmed of avoidable infection, and because of antimicrobial resistance, no one should catch an infection while receiving healthcare, yet this infection can spread through outbreaks and many regular care practices affecting hundreds of millions of people across the world every year. The following are the key factors to lessen the spread of virus in every part of the community. Hand hygiene, whereas everyone should use every day. Preventive actions, including regularly washing their hands, avoiding touching their eyes, nose, and mouth, and recovering their coats. For aspect of standard infection control, monitoring and capacity to respond to cases of COVID-19. The response of COVID-19 in correctional and detention facilities should consider the broader mental health impacts for residents and staff, both for those with and without pre-existing mental illness. Some COVID-19 prevention measures such as prolonged quarantine periods, repeated isolation, and restriction on visitation and programming are known to lead to negative impact on mental health and well-being. For modifying COVID-19 prevention measures at the facility level using data on local trends and facilities characteristics. As epidemiologic trends shift due to variants and other factors, administrators may consider strengthening or relaxing COVID-19 prevention measures from individual facilities based on the 5 primary metrics listed below. No single metric should use alone in decision making. Consult with local public health partners in decision making about modifying prevention measures, especially for facilities without internal public health or infection disease experts.
Chapter 3. Research and Methodology. Methods and Techniques. Descriptive research. The researcher will provide information about the condition, situation, and event that occur in the present, occurring inside Bataan District Jail with regards on how they maintain health standards, protect, and mitigate the impact of the coronavirus on prisoners. The next one is evaluate research. The study will require use scientific process on collecting and analyzing information about the quality, effectiveness, efficiency, and valuable efforts made by the authorities on our research locale. The third one is qualitative research. It is used to uncover trends in thought and opinions and dive deeper into the problem. The researcher's data collection design varies using unstructured or semi-structured techniques. In addition to common methods include focus group discussion, interviews, and participatory observation. The last one is statistical treatment. They have no statistical treatment is employed in the study. Research instrument. The first step is employed interview, protocols, and documentation process. The second step is focus group discussion. The last one is documented response of Bureau of Jail Management and Penology among jail officers during pandemic. Construction and validation of instrument. The researchers constructed interview protocol that is aligned to the statement of the study, incorporating question and the researchers with book, journal, unpublished thesis, and other references connected to the study and give significant information for the findings of the present study. Suggestion and recommendation from the research instructor and advisor were undertook and incorporated in the interview. Data gathering procedure. The first step is a letter of permission was approved by the Dean of College of Criminology and noted by the thesis professor and advisor. The letter is addressed to the OIC Senior Jail Officer 4 of EJMP Batangas Jail. The second step is the research instrument were explained to the respondent before the actual collection of the COVID response plan. The third one is the respondent of the study had the freedom to organize their answer in their own way in the most appropriate situation. The fourth one is the research also conducted visual communication with the aid of video recorder and voice recorder. The last one is the result of the study are recorded, organized, and tabulated. Focus group discussion was done after gathering pertinent data and information. The treatment of data. The data collected through methods of observation, one-to-one interview, conducting focus group, and similar methods. The second one, the data gathered with the various data gathering procedures will be tabulated and documented based on the authenticity of their answer and will be checked by the connected bodies such as the research local and respondents. The third one, then it will be analyzed, interpret through use of table and textual discussion to answer the specific problem of the study. The last one is additionally, recommendation will be listed at the end of the present paper. The researchers made use of textual discussion to answer the specific problem of the study. It especially deals with the realization of findings as follows. Number 1, status of the respondent. Number 2, what are the responses implemented by the Bureau of Jail Management Penology with regards to dealing with the COVID-19 persons deprived of liberty? And number 3, what are the strategies for applying and sustaining COVID-19 prevention measures inside the correctional and detention facilities with regards on the following matter? Setting and sample. Prior to administration of several observation and interviews, permission was obtained from the informant. In the actual data gathering research, interviewed the 5 key informants which are the jail officer. The informant gave all needed information for the success of the research study. Here is the list of the key informants. Name of the respondent, Rismar Chavez, Jail Officer 2. Number 2, the second respondent is Aubrey Joy Isip, Jail Officer 2. The third respondent is Maria Jane Rosario Labao, Jail Officer 2. The fourth one is Gretchen Bernalte, Jail Officer 2. And the last one is Carlo Rimas, Jail Officer 1. Chapter 4, Presentation, Analysis, and Interpretation of Data. Responses implemented by the Bureau of Jail Management and Penology dealing with the COVID-19 persons deprived of liberty, medical isolation, and quarantine. We plan and ensure that the health of other PDL inside the jail for the sake of PDL if the PDL shows symptoms or is positive through the testing. We place them in separate facilities wherein we observe them for 14 days before, but since we are on the alert level 1, we only gave them 7 days. And if she is already okay, by the corresponding time, he or she will going back again to her designated room. Even if our province is under alert level 1, it does not necessarily mean the cases are eradicated truly. So, isolation and quarantine and contact tracing are strictly guidelines to follow by both the jail officer and the DDL. According to the study by Hewell et al. 2020, in most scenarios, highly effective contact tracing and case isolation are enough to control a new outbreaks of COVID-19 within 3 months. The probability of control decreases with long delay from symptoms onset to isolation. Fewer cases ascertained by contact tracing, and increasing transmission before symptoms. Moreover, according to the World Health Organization, or WHO, isolation and quarantine are one of the most crucial and significant ways how to eradicate the spread of the COVID-19 virus. Testing consideration. Consideration. On COVID-19, testing for PDLs who have the symptoms we often and antigen, test kits, and RT-PCR. The study of Kronberg et al. 2021 revealed that RT-PCR and antigen test kits are effective and essential in limiting the COVID-19 pandemic. These tests provide results within a minute. However, the accuracy has been questioned. In addition, the study of Bolivar 2021 showed that these tests are vital and significant in the fast detection of COVID-19 positive. Medication for prevention of severe COVID-19 cases. We are ensured that 100% of the PDL are fully vaccinated, and if someone will have a symptom and will be positive on the test procedures, he or she will be isolated and will be given a medication for prevention. Next slide, please. Vaccination for PDL. Before the PDL will enter to the jail, we make sure that they undergone vaccination process completely, and if not, he or she will be separated meanwhile while waiting for the vaccination to occur. PDL with medical issues will seek the doctor advice before having the COVID-19 vaccine, but we make sure that we separate he or she to other vaccinated ones. We also encourage our PDL to have their boosters. Now, we are busy having vaccination drive for the 4th dose of the booster. According to the study by Thomas et al. 2021, vaccines continued to be safe and have an acceptable adverse event profile. Few participants had adverse event, leading to withdrawal from the trial. The efficacy was 91.3%, 95% confidence interval level. Through 6 months of follow-up among the participants without evidence of previous SARS-CoV-2 infection who could be evaluated. In addition, the WHO encouraged everyone to undergo vaccination because it is the best way to eradicate the cases and for us to achieve herd immunity. Infection and prevention control. In prevention control, since some of the court are continuously been going on, we disputed medication for the prevention of the virus and strengthen the immune system of PDL. We are distributing vitamin C capsule and other essential vitamins. PDL who are just ended their schedule on hiring in the court will go straight to the shower area to wash their bodies to avoid the contact of the virus or to fully be sanitized before we go back to their corresponding room. Newly entered PDL will also be granted to have these vitamins. Every routinely activity of the PDL and jail officers as well it is must to have hand wash time, sanitation, and hand washing if necessary. Each station of the jail does also have some sanitary places like sink and faucet with hand wash soap. We also provided alcohol standees. We also have markings to continuously practice the social distancing. We also some signage for them to be reminded about the do's and don'ts. As much as possible, we administer event and other occasion with just the right number of participants or possible, we do virtually. According to the study of Abu Bakr et al. 2020, vitamin C level in serum and leukocytes are depleted during the acute stage of infection owing the increased metabolic demands. High dose of vitamin C has multiple pharmacological characteristics: antiviral, antioxidant, anti-inflammatory, and immunomodulatory effect, which make it a potential therapeutic option for the management of COVID-19 in different countries and has shown promising results. Next slide, please. Strategies for COVID-19 prevention. Measures inside the correctional and detention facility. Visitation. Even if our province is under a level 1, we still need to prevent and protect our PDL and ourselves from the harm of the virus. With that, we still have e-Dalaw or the electronic e-Dalaw virtual visitation program, saying that it provides great relief for the person deprived of liberty or PDL to communicate with their families. Food, things, and other belongings came from their relatives. Aside from inspection, it is must go undergo sanitation. The Department of Health, DOH, introduced the new normal visitation, which is e-Dalaw or electric Dalaw. DOH 2021, e-Dalaw is a method wherein the PDL and their families can rely on a video call or any social media platforms within just 30 minutes a day. This virtual visitation also had a significant result in Canada, the US, and Korea during the midst of the COVID-19 pandemic. Next slide, please. Preparation for outbreaks. We are ensuring that we have enough supplies like medicine and sanitary things to offer for all. We are ensuring that we strictly follow basic and major guidelines that were being mandated by the higher-ups and especially from the Interagency Task Force on Emerging Infectious Disease. We are also making sure that case COVID-19 should be addressed ahead of time to avoid any further outbreaks that may lead a worse scenario. Stay still the contact with other agencies of the government that will help the jail community. As stated by the WHO or World Health Organization 2021, all countries should increase their level of preparedness, alert and response to identity, manage and care for new cases of COVID-19. In addition, countries should prefer to respond to different public health scenarios, recognizing that there is no one-size-fits-all approach the managing cases and outbreaks of COVID-19. Moreover, according to Marhill, 2021, COVID-19 must be addressed ahead of time to stop the spread of virus. Preparation for outbreaks. All individuals in the jail should use preventive action, including regularly washing their hands, avoiding touching their eyes, nose, and mouth, and covering their cough. Facilities or stations should ensure adequate access to hand hygiene materials. These materials should include soap, water, and clean towel or alcohol-based hand sanitizer with at least 60% alcohol. According to Here et al. 2021, touching eyes, nose, mouth, and even singing can be an agent in the spread of the virus. Therefore, it must be limited or prevented In addition, according to WHO, complete access to hand hygiene must be practiced and regularly done. Washing and sanitation must be included. Cleaning and disinfection. Restocking cleaning and disinfection supplies. Ventilation. We are ensuring that ventilation systems operate properly and provide acceptable indoor air quality for the current occupancy level for each space. Improvements and repair should be made as necessary. According to the WHO, proper ventilation is a must to pass through the air and avoid isolation of the virus in a specific place or location. Next slide please. Quarantine. Physical separation of an individual who has had close contact with someone with confirmed or suspected COVID-19 to reduce the risk transmission to others if the individual later found to have COVID-19. Required to all PDL jail officers, staff, visitors, vendors, volunteers, and any other persons in the facility to wear a well-fitting mask and respiratory while indoors. Restricting work release programs. Postponing non-essential community visits. Restricting movements across different areas of the facility. Restricting movement between facilities. Restricting in-person visitation while ensuring access to virtual options. Limiting the size of the group activities. Temporarily suspending group activities where residents will be closer contact that they are in their housing environment, while considering the impact on mental health and access to service. Implementing the comprehension population reduction strategies. According to the study of Bureau et al. 2020, the result of the study showed that the benefits of quarantine, contact tracing, screening, and isolation in different settings are the significant quarantine along with other can also have the reproductive number and reduce the incidence, the shortening the epidemic period effectively. Early initiation of quarantine, operating large-scale screening, strong contact tracing system, and isolation of case can effectively reduce to the epidemics. Lastly, quarantine, contact tracing, screening, and isolation are effective measures of COVID-19 prevention, particularly when integrated. This is Chapter 5, Summary, Conclusion, and Recommendation. The summary of findings. Based on the data analysis in the study, the finding can be summarized as follows. Number 1. Based on the data gathered by the researchers, guidance on designing a flexible COVID-19 prevention plan based on COVID-19 community level and facility level factors are visible. Number 2. Bataan District Jail has detailed guidance on implementing specific prevention strategies and correction and detention facilities. Number 3. Bataan District Jail has a separated COVID-19 prevention strategies into 2 categories and provided guidance on when to apply each category in correctional and detention facilities. Strategies for everyday operation. COVID-19 prevention strategies that correctional and detention facilities should keep in place at all times, even when the COVID-19 community level is low. Enhanced COVID-19 prevention strategies, additional COVID-19 prevention strategies for facilities to use when the COVID-19 community level is medium on high or when facility level factors indicate increased risk. The conclusion is, in the light of the findings of this study, the researcher arrived to the following conclusion. The health protocol set by the Interagency Task Force, or IATF, on emerging infectious disease were being observed in Bataan District Jail. And our recommendation is in view of the finding, the following recommendations are suggested. Number 1. Facilities should maintain the ability to add, remove, enhance COVID-19 prevention strategies based on ongoing risk assessment. Number 2, Bataan District Jail may innovative that visitation process strengthening the IDA through video call is hereby recommended. Number 3, hire additional personnel to supplement the needed number of jail personnel. Number 4, restriction for personnel movement during off-duty prevent possible contact with COVID-19 possible outside. Thank you for listening.